everybody, this is Dr. Schroder with this week's video introduction to week number 2 in class. Now, we've had a busy week this first week, but I think that everybody's off to a really good start, and I think that we're getting ready for a really good class. I think that things are going to continue to go well. You had a lot to do this first week. The first week, your first task was to complete your Strength Finders assessment, and then write a discussion question and respond to others about what you felt about that. And in going through and reviewing the responses this week, and I left many of you some feedback, it's there's certain limitations to something like Strength Finders, but there's a real value to it as well. It's a nifty kind of a thing that we do, and it's something that is valuable because it is a very simple test to complete, but it does yield quite a bit of information, albeit very general information, about what our own personal communication and leadership styles are. And that's going to be important as we move forward, because each of the classes that you have in the program is going to have some focus on nursing leadership. One of the big differences between a bachelor's prepared nurse and associate's degree nurse is this education and skills building in leadership. And so leadership is going to be an important concept all the way through the program. Then another discussion question dealt with your views on professional nursing. What does it mean to be a professional nurse? And I posed the question, is there a difference between a BSN and a associate degree nurse in terms of being a true professional nurse? And that question is one that I pose quite often. It was reflected in the reading this week, but also it's also an important component or an important tenet of the American Nurses Association, who holds that a bachelor's degree should be the bottom line or the entry level for nursing rather than an associate degree. The American Nurses Association isn't down on associate degree nurses per se, but some years ago they saw the value of having bachelor's prepared nurses and requiring bachelor's prepared students to be able to tackle the issues that were coming up in nursing. And so in fact, that's a big reason why now there's such a big push for it, and why 5 years ago there wasn't really that much impetus to have, if you had an associate's degree, unless there was a particular job that you were going for or was required, it wasn't really viewed as being that extremely important, especially if you had experience. However, in today's world and in today's healthcare environment, it's becoming very important, and is in large part because of the the additional education that bachelor's degree nurses get in nursing science and research, nursing theory, and in nursing leadership. And that's really what separates the bachelor's prepared nurse from the associate degree nurse. Of course, anybody that's worked in nursing for any time, especially as an associate degree nurse, would question, how can nursing be even questioned? Is it a real true profession? But in the world of healthcare, when you're compared against doctors and social workers and occupational therapists, recreational therapists, physical therapists, that all, in most cases, have a master's degree and at a minimum a bachelor's, there is a little bit of a kind of like looking a little bit of a sconce eye at, are these nurses really ready to, tackle understanding what we need to do in determining what the overall healthcare spectrum should be, especially considering that they're the ones that are with the nurses. We nurses are the ones that are with the patients 24/7. So that's a really important question. And so it kind of highlights the importance. Studies have shown that one of the big differences between associate and bachelor's prepared nursing at the bedside, and it was mentioned in class that associate degree nurses have more clinical hours, which isn't really true. Actually, bachelor's prepared nurses do have the same number of clinical hours, just spread over a longer period of time. But the associate's degree nurses don't come out with stronger bedside nursing skills. And they do because the bachelor's prepared nurses are getting a more rounded experience and not at the bedside nearly as much as the associate degree are. And so the associate degree are sort of experts at that upon graduation. However, bachelor's degree graduates come out with higher critical thinking skills. and greater leadership skills, and that's been measured in several different studies. And after 6 months of experience, the bachelor's degree nurses catch up with the associate degree in the skills category, but without further education, the associate degree nurses do not advance in critical thinking skills unless they actually get some advanced training. So that's really kind of the bottom line here, and that's why the bachelor's degree has really become as important as it is. And that doesn't mean that there's anything lesser about an associate degree nurse. And in fact, it's an unfortunate situation that there are some nurses out there with their bachelor's degree that do have somewhat of a, I would say, a haughty attitude, that sometimes making it sound like they are better than, and that the associate degree nurses aren't greater than, and that's not the point. That is not correct. And but I have witnessed that also in the clinical realm. I have seen, for example, bachelor's degree nurses with less experience than an associate degree argue that they should be taking care of a more complex case just because they have the bachelor's degree. And the associate care nurses, well, they should be at a lower level somehow. That's not the idea, and that is not correct. But unfortunately, that is and it's some misperceptions that need to be corrected out there. But that's kind of our jumping off point for class in this discussion. You also did a weekly reflection discussing your personal worldview. That's really, the weekly reflections each week are really kind of a personal journey. That's going to be different for each of you. I have you post them publicly in a forum, but don't require anybody to give feedback, although you're welcome to give feedback to other students if you would like to. But everybody's different. Not everybody in class is Christian. Those that identify as Christian come from many different faith backgrounds, and we do have some people in class that may not have any faith, or may not at least really looked at their faith as being an important part of their life, as much as somebody that, for example, like goes to church every week. And that doesn't mean that those people that go to church every week are better than, or there are also somebody that have any special skills or gifts or anything. It just means that we're all on a different path on this journey together. And that's really what this talk is. In week number 2, the week you have coming up, you have 2 discussion questions. The first is going to be a writing exercise where you're going to work through the Smart Way book, this little book here that we started using. And you're going to complete the first chapter exercise where you go through and identify your own paper writing strengths and weaknesses. We understand that many students in class at this level, sometimes writing is, for many people, that's one of the things that keeps them from going into a bachelor's program, is they're afraid of all the writing that they know they have to do. So this exercise will help you identify what those strengths and weaknesses are and help you to gain some confidence as we move forward. And then your second discussion question this week is going to be focusing on nursing theory. And at this point, really just discussing theory in a very general context. Your next course, which is RNRS 307, is going to focus specifically on nursing theory. And so you'll be delving more deeply into the topic then. But in this week, we're going to discuss really more generally what a nursing theory is and how is nursing theory important. There's many misconceptions about nursing theory, and so I'll be participating in class with you, giving feedback to help guide that discussion as well. And then you'll have a weekly reflection continuing to develop and grow in this idea of nursing from a Christian worldview, and specifically answer the question, is nursing a calling or is it a vocation? Is it something that people are truly called to do, or is it something that is people choose to do just like any other position? A lot of discussion about that, particularly in Christian circles, as to whether nursing really is something that is, is this something that can be considered a true calling? For many of us it is. And so we'll discuss that a little bit. And then finally, your first paper of the class is due this week. It's your professional nursing practice paper. And this is where you're just going to be discussing the concepts really that we've discussed in class up to this point. What are some of the concepts of professional nursing? How is professional nursing, what are the different levels, educational preparedness for different levels of nursing. And you'll be able to share your observations and your knowledge and your research with that. It's a fairly simple paper at this point. For many of you, this is going to be the first paper that you've written in a long time. For others of you write more frequently. But it will be an opportunity for you to also get feedback. As a matter of fact, more than anything else probably in this paper, feedback on your writing style and paper structure. And so I look forward to reviewing those. Those are going to be due by Sunday night, turned into Turnitin. Please sign up for Turnitin. Register an account if you haven't done so already. I'll be checking later this week to make sure that everybody's on board with that and everybody's getting everything done. Or that everybody has signed up for Turnitin. Let me know if you have any questions at all. For your feedback this week, your grades for your first week in class should be ready, I'm guessing probably by Thursday afternoon. I will start grading. I'm recording this on Monday. Today's Labor Day. So I will be starting that grading either later today or possibly tomorrow. And all the grading should be done for the class. I'm guessing probably by Thursday, at the latest by Friday. But you'll see your first grades in the grades book before the end of the week. So with that, I just say a quick prayer and say, Dear Lord, thank you for this time together once again. Thank you for bringing us all together. Thank you for the great attitudes and the great work that everybody's done. Help keep us safe. Help keep us with as little anxiety. Help keep us as happy as we can be, Lord. And be with us as we continue to walk in this journey together. As we pray in your name, amen. And with that, I wish you a great week. I will be posting some office hours later this week. Let me know if you need to meet with me or need to talk with me on the phone anytime this week, and I'll be more than happy to do that. And I look forward to seeing you in class and seeing you in the discussion forums.